and welcome to the last session. So my name's Sue Cook and I'm an adjunct senior lecturer at Griffith University, where I've been teaching about climate change and public health on a casual basis for the last 13 years or so. I also do a little bit of consultancy work with the Climate and Health Alliance, and in that role, I was involved in working with the Queensland Human Health and Wellbeing sector to develop the Human Health and Wellbeing Climate Change Adaptation Plan in 2018. I'm also now involved at Griffith with a climate action beacon, which is Griffith University's involvement in and investment in working with society to bring about the changes that we need. And as part of that, I'm involved in a project with a couple of hospital and health services here in Queensland called Facilitating Climate Resilient and Sustainable Healthcare. So very much interested in everything that's been happening today. So can I just also pay my respects to Indigenous leaders, past, present, and emerging. We might move almost immediately forward. The topic that we're on this afternoon is about climate risks. So climate change is already impacting health service delivery, and so assessing climate risks and developing plans to address them present opportunities to also reduce emissions, avoid future costs, improve health and well-being of communities, and ensure climate risk governance obligations are being met. So I'm really looking forward to this panel. So let me first of all introduce Dr. Peter Schneider, who works at Queensland Health and has been a project lead and key contributor to the development of the Queensland Health Climate Adaptation Guideline, the Climate Risk Strategy, and the Queensland Health Aboriginal and Torres Strait Islander Environmental Health Plan. So Peter's had significant management and research experience in the areas of toxicology, oceanography, water supply, and natural resource management. He's worked as a CEO, executive manager, researcher, and industry consultant in the private, academic, and not-for-profit and state government sectors. Welcome, Peter.
Good afternoon, or almost evening to everyone, and thanks for being patient and still being here. It's always harder later in the day. Look, I'd like to first acknowledge the land, the traditional owners of the lands on which we meet, and pay my respects to the elders, past, present, and emerging. I'd also like to take the opportunity to thank the team and support organisations that contributed to these guidelines. I'll give you a very brief overview, but this is a work of 3 years and often quite detailed work. We've had a lot of support from the National Climate Change Adaptation Research Facility at Griffith Uni. CAHA have given us a lot of support in the background. And I think often when people give you support, they don't realise how important it can be because they don't necessarily see all the barriers you're dealing with. So it does help. So thanks, Sue. Just wanted to say that. All right, so the talk today is about the guidelines we've developed, but first I'll give you a bit of history. They were developed as a sector guide, so anyone in the health sector should be able to use these, and they're available for you to use. So, overview. So Queensland Health established the Climate Change Working Group in 2015, and that's probably the seed of where all of this first was generated. But the work was a bit nebulous and unfocused, and then in 2018, as you mentioned earlier, there was a HCAP, or a Health and Climate and Wellbeing Guidance Planning document released by the Health Minister, and it was for the health sector to work towards developing their own climate adaptation plans. We took that document and then spent some years in consultation. Queensland Health is a big beast, the health sector is a big beast. And and it took some 18 months to get through that consultation process. We then developed the guidelines, probably a bit topsy-turvy. The strategy then followed the guidelines. We needed the guidelines out ASAP, I think, for obvious reasons. And then for the first half of this year, we've been running a series of training workshops with a number of HHSs and Queensland Ambulance Service. And the feedback on that has reinforced that we did achieve what we intended to achieve with the guidelines, and that's that total novices can just pick them up and work with them. So their usability was ranked 9 out of 10. But I'm only telling you what you probably find out for yourself. Hopefully you'll find they're easy to use. If not, I'd really like to know, and I'd like to know where the problem is. So we've done the training, and I think most recently, as of last year, the Office of Hospital Sustainability was established, and I think there was an earlier speaker with regard to this in this conference. So the strategy, I'll only dwell on this very briefly. There are 8 themes. The 8 themes were consolidated through the consultation workshops that I talked about before. So we didn't sit down and go, these are the areas we need to work in. We spent 1.5 years asking people what they thought Queensland Health should work in. As you can imagine, we had about 15 different areas, 15,000 different areas identified, but we managed to pull those together into those 8 themes. And surprisingly, those 8 themes are very consistent with the HCAP, the guidance document that Kaha and others helped to prepare that was released in 2018. So I've got leadership and governance highlighted here. Why? Because in the red there, that part, the very first theme in the strategy says, please use the guidelines. This is the tool you need to use. So it's embedded in the governance and leadership process. Can't get lost. So what are the guidelines? The guidelines are really, we've called it lots of things. We've called it a toolbox, guidelines. Really, we've got a guideline. We've got an almanac, which is a fancy word for a compendium of information. And we've got 2 sets of Excel spreadsheets. And those Excel spreadsheets ask you a series of questions and lead you through the process. So as you go through and answer your questions, you're actually traveling towards the final question, which will then leave you with a climate adaptation action plan. So it's as simple as that. So you've just got to go through those questions. They're sticky questions in parts. So, and as I said, they're designed for the novice to be informed and progress. And so the almanac, the guideline, will provide you with a lot of information. And once you've started that process, the almanac provides you with even more. So as you go through the, excuse me, a bit dry, you'll see lots of examples of, well, what are the sorts of risks the health system will face? What are the sorts of options to respond to those? I can't stress the need for adaptation enough, I think, because just recently, everyone knows Britain, the health system in Britain's a little bit ahead of us in this space, but they've just admitted to not being able to meet their mitigation targets because they've not actually kept up with the adaptation requirements. So really the lesson in that for Australia is that we need to work with both parts equally and pay equal attention to both mitigating and adapting to climate risks. So I talk about risk assessment, and the guidelines are actually a 2-tier risk assessment. So the tier 1 is what I call a context study. It's about informing you about the climate risks you're working with, the types of hazards that you're going to categorise, the actual risks associated with those hazards, and the types of options you need to start thinking about. It's very broad, but what it does do is you come out of that process going, okay, temperature and sea level are our 2 biggest issues. We need to focus on those. The guidelines are the second part of the risk assessment. The tier 2 really gets down to the nitty-gritty. You're looking at your likelihood and consequence ratings. You're looking at your residual risks. It's the hard part of the risk assessment. But if you've done the first bit, the second bit becomes a lot easier. And And I think if I contextualize it even further, anyone here goes scuba diving at all? No? Oh, there's one. Oh, you're a very risk-averse bunch, aren't you? That's good. No, well, I mean, when you go diving, I was a commercial diver for many years. You know, you check your gear out, you test your regulator, you make sure you've actually got air in your tank. You'd be surprised how many people go diving with no air in their tanks. I've never done it, but I've been with people who have. So that's a very basic form of risk assessment. And so if you're a risk-averse person, you'll be very thorough. So if the same person then does a risk assessment, you'll take the worst case scenario in terms of risk. You'll work with an RCP 8.5, worst case scenario. That's I think 4 to 6 degree temperature rise that we're heading towards. If you're not risk averse and you're one of these people that goes diving with no air in your tank, you'll probably go with an RCP 2.6, which we've already exceeded, I think. So just giving you a bit of sense there. So really you assess your hazard. It might be temperature increasing over the next 30 years. The risk to that can be a multitude of things. It can be risk to your utilities provision, your water supply, your energy supply. It could be something as simple as not being able to hire staff because it's just too hot where you are. And that's actually a serious and emerging risk right now in our Western regions. And I think the Northern Territory recently reported that there's an exodus of medicos because it's just gotten too hot for them. Anyway, as I mentioned before, as you progress through the process, you'll end up with an action plan. And from that, then you'll work out what you need to implement and monitor. The process is meant to be a self-defining one. So there's no guidance given on what you should do, what you have to deliver, when you have to deliver it by. It's meant to be an exploration of your own needs. And so as you go through it, the realization will come that some things you need to do now because your awareness is constantly fed with information throughout the process. So, okay. It's a while ago since I prepared this, so I've forgotten what I've done. So the guideline itself, the first volume, provides some minimal background. It gives you a context. It talks about climate change impacts to HHS. This is all the sort of things you should be thinking about if you're not thinking about them already. The benefits that you can achieve by managing those risks. And it also talks about definitions. And yes, climate change does have its own language and you need to familiarise yourself with that. And then there's the how-to. So the scan cycle, it'll ask for probably the most basic information. What sort of documentation do you already have? Do you have emergency plans, business resilient plan, staff management plans? It asks you to start collate that information and bring it together under a single umbrella. You're not replacing it. You've just got it there to feed the beast that you're going to work with. At that point, and having done the tier 1 risk assessment, which is your basic risk assessment, you may even decide not to take it any further. You may decide that there aren't sufficient risks or a need to do anything at this point. You might be in a very low impact area, and so you may not take it any further. It's unlikely, but it's always a possibility. You'll also be pulling together the internal stakeholders or brains trust you will need to do this. It's not meant to be done, but you're not meant to do it on your own. So really you need, if you look at the strategy theme areas there, the theme areas covered everything from governance and leadership to HR, to research and innovation, public health. All those elements should be represented on your stakeholder list. It's a simple guide. So your stakeholders will be a minimum of 8 at least. And they'll be your brain's trust for going through this process. Hopefully I haven't completely confused you, but anyway, we've got a template example here. Oh, that's out of sequence. Never mind, I'll work with it. So you can see here, can you read all that? Is that clear to everyone? Yeah. So the basic elements, this is the tier 1 again. Why are you doing this? Have some sort of, I better hurry up, hadn't I? Okay. What's your time frame? What scenario, climate scenario you're going to work to? People that you want to be a part of the process. You list your stakeholders in it. You've got a term there of 2030. Some people I was working with recently just set their term as 10 years from now because that's where their current business plans were at. It makes sense. There's no rule to this. It's about what works for you. If we're looking at temperature as an example, this takes you through the process in the tier 1 risk assessment about looking at all the types of risks that might be related to your system where heat's concerned. It's everything from energy management to assets and operations to service delivery, as I mentioned earlier, and so forth. The Almanac supports the process. It describes what the various model scenarios for the future are with the implications for those. It also provides some pretty useful prediction data. You can look at Croydon, for instance. It's going to go from 138 days of greater than 35 to, give or take, 240 days over 35 a year. And over 40 goes from 10 days to close to 40. So they're big extremes. And what's further discussed in the Almanac is what that means for extremes. The extremes are right out of kilter with those changes and a lot worse. And you've got broad detail, but there's a lot of information there. And it's all provided on a regional basis because you can't really provide information for the whole of Queensland and say work to that. So it's broken down to 16 different areas, which happen to correlate with the HHS areas of operation for Queensland Health. And so the information is specific to those areas. And this is just more information provided in the Almanac again, and there's pages of it, which gives you ideas and options for battling climate change. Now we've got a web page internally that's set up. An external one should be up in the next week or two. It should mirror this. And on this current website, we've got the guidelines, the strategy. We link into the Global Green and Healthy Hospital System because they've got some fantastic tools. Have a look at the site. It's worth a look. And if you have any questions, you can reach me on this link. And if you want the guidelines, strategy, anything now, contact us. I'll send it out to you by email. Thank you.
Fantastic. And Queensland is actually, surprisingly, some may think, ahead of the pack on a number of areas. So can I now introduce Professor Claudia Baldwin and Dr. Tony Matthews. Claudia is the professor of, a co-director of Sustainability Research Centre at the University of the Sunshine Coast, who uses participatory and visual methods to research institutional and social environmental change. Dr. Tony Matthews is a senior lecturer in urban and environmental planning at Griffith University, where he's a member of the School of Environment and Science, as well as the city's Research Institute. Welcome.
Thank you all for staying. Can you hear me okay? So we're going to talk about using green infrastructure to address heat waves and heat stress for seniors and aged care facilities. I'd like to acknowledge that we're just part of a project team, multidisciplinary project team with people with social science background, planning, landscape architecture, and thermal comfort technology. And we really appreciate the support and interaction with our wonderful partner, Uniting Care. The project is funded by Queensland Department of Environment and Science through their Sector Adaptation Planning Co-Investment Program. I would also like to acknowledge the traditional custodians of the land where we, our project team, live and work, the Gabi Gabi, Jagera, and Kumbameri. We pay respect to ancestors and elders, past, present, and future. And I recognize the unique cultural and spiritual relationship and celebrate the contributions of First Nation peoples to Australia.
Good afternoon, everybody. And can I just echo Claudia's appreciation for everybody's attention at this late stage of the day. There's been so much fascinating work presented today. It's hard to keep focused, but thank you. Why did we do this project? Why is this important? Well, obviously, Claudia's talked through who we've partnered with, but what's the common interest here? Well, what we're interested in doing and what we're working towards is developing model heat adaptation plans for aged care facilities, initially in the subtropics. And that's important because what will work in the subtropics may not work in the full tropics and may not work in a temperate area or an oceanic area or so on. So the subtropics has been somewhat underserved in terms of looking at the potential for green infrastructure application. So that's what we're doing. And we're trying to produce a model heat adaptation plan for the aged care sector that can then be translated into specific adaptation plans for individual centers or individual facilities. Green infrastructure, as we understand it in this study, is not greenery for aesthetic reasons. It's not greenery to cover space. It's not filler material. We're talking about green infrastructure as a specific form of technology that has properties, that offers benefits, services, has applications in particular areas. And so it's a much more systematic and strategic thing to use. This is not a project about filling space with grass and hedges just for the sake of it. This is much more targeted than that, as you'll see. Our work to date has focused on 2 aged care facilities, both of which are on the Sunshine Coast and both of which are in the Uniting Care stable, and it's been wonderful to work with them. We've got some great work done there. Why do this research? Why worry about aged care facilities? Why worry about or consider the potential for green infrastructure to affect any kind of benefit there? Well, 3 reasons really. Obviously, climate change is one. I don't need to walk you through that again. I'm sure you're all more than familiar with that at this stage, but particularly here in the subtropics, heat is a problem, which we've heard time and time again, and that's an even bigger problem for seniors, as many of you know well. Using green infrastructure in aged care facilities offers many benefits for many people, but particularly offers multiple benefits for seniors beyond reducing heat. It can do that if deployed well, but it's also very good for stress relief, for improving sociability, walkability, getting people outside more, engaged with each other and engaged in the facility more generally. So there's some significant benefits around that. And also for aged care providers, gives you greater marketability potentially. You stand out in a very crowded market, and has enormous benefits as well, not just for the residents, but also for their families who visit and for the staff that work at aged care facilities. And particularly in that industry, there is a very high turnover of staff. So anything that can be done to attract and retain high quality staff, including environmental upgrades, is surely a good thing. I'm not going to go into significant detail on our research design and methods. Suffice to say, we have a number of different aspects to our research design and a number of different methods. The one that probably is most influential in our project, and the one that we've had to do the most primary work in developing, is our environmental audit. Now, this, to our awareness, is the first of its kind, and this has in large part benefited from the fantastic involvement of Dr. Chris Boulton from the City Green Lab, who's been working with us. So what we did is, there's a standard or a relatively standard template way to do a green infrastructure environmental audit. Then you have other methods of doing environmental audits, taking in principles of things like universal design and also crime prevention through environmental design. We combined all of those together into a single environmental audit tool, which we then use to audit these facilities. And not to go into all of the many different sub areas of this tool, but there are many. There are many, and we will be putting a paper out about this very shortly that specifically talks about this tool and how you would apply it in an aged care setting. So that's a significant contribution in its own way. Just to give you a little bit of a sneak preview, and I'll just call it a sneak preview of some of the interventions that we are proposing. Now, bear in mind, these are site level interventions at existing aged care facilities. These derive derive downwards from the overall heat adaptation plan that we've drawn up. So this is how some of those principles and priorities would apply in specific aged care settings by area. So if you just look at the larger image there to the right-hand side, you can see that we've superimposed quite a number of new things upon the image. Now, this is the arrival area of the Blue Care Caloundra aged care facility. There's an awful lot of tar macadam and bitumen out the front there, for example. So that's generating a huge amount of urban heat and heat island effect. So one of the quick ways that you could reduce that is by doing some judicious tree planting. Now, there's some important questions that need to be asked there around what sorts of species do you plant? What are the risks associated with them? How can you mitigate for any of those risks, including branch drop, excess leaf pileup, fire even. So you can make choices around that, some very sophisticated choices. In a separate project that I have going on, we're looking very deeply at this question of species selection for green infrastructure in the subtropics, but I won't get too much further into that. Also, some very useful things that you can do here. You'll notice the black box there over the crosswalk. We would suggest the permanent installation of a fixed roof structure there to reduce exposure to the sun. It's also a place where a lot of the residents spend a lot of time outdoors. So anyone coming or going or spending time in that area would greatly benefit from that. And then shade sails over the car parks. Again, that's not green infrastructure. We're not using trees there, but there is a limit to what you can do using green infrastructure. And we're not so proud as to say that there aren't other interventions that can be useful in tandem. Just to look at another set of images as to what you could do. So we broke this and the other aged care facility, we broke them down into subsectors, and we looked at each sector separately, and we did our own research around each sector and spoke to residents and collected data and established baselines, and then came up with a series of plans for each of these sectors to activate them with green infrastructure, not just to reduce heat and heat stress within the facility, also to improve views out of the facility and to give residents and staff a reason to go outside, attractive nature-based opportunities to go outside. And you can see there that we have a number of different opportunities that we have suggested or ways that you could convert each of these settings. And in our plans, we have provided a way of doing this in a sort of a phased approach. So there's a sort of a stage 1, a stage 2, and a stage 3 over time as budget becomes available. So there's the most priority down to the add-ons at the end. But we've organized it as such because we understand that there aren't giant pots of money waiting to be spent in every aged care facility. So we're realistic about that. I'll leave it there and hand back to Claudia for the rest. Thank you.
Okay, so I guess one thing to keep in mind, as you would know, adaptation planning involves an iterative process of ongoing monitoring and evaluation of actions and of the environment and the human response. Some of the strategies for cooling that we considered were shade structures over paths and resting places, vegetation, green walls, reflective roofs. Putting solar panels on a roof actually provides shade on that roof. So it does more than just provide the shade, it provides cheaper electricity. And we did some work in wayfinding and things like that. We also looked at, we used heat sensors and thermal cameras to determine locations that were hotspots in these places. And so one of the priorities we would suggest is, tackle those areas of the greatest levels of discomfort or where there's very poor access or personal safety. And also those that provide multiple benefits. So shaded benches for resting and socializing fulfill a couple of different functions. In conclusion, some of the things that we learned or confirmed from this project were that principles about the importance of engaging the client, engaging residents, engaging staff to improve our understanding of their use of the site, their needs, the risks, their values, and the things that they value, things like birds and trees, and to get their buy-in. We found that good data helped to establish the priority areas that we would recommend. We also, through a range of consultations, realize how important it is to get management commitment, possible training, and to have champions. I liked the idea of the Metro North mentioned this morning about having green teams. And if you had a team in each aged care facility, then you could cover a range of interests to address these issues. As I said, there are multiple benefits from implementing green infrastructure. Not only can it provide cooling, but you improve biodiversity of flora and fauna, the amenity, reduces stress, improves health. And you can design it so that there's less maintenance if you use native vegetation, and lower costs, so you're not mowing lawns as much or pruning hedges. Plants, garden features, path design can all enhance wayfinding. We found a number of residents really didn't know how to describe where they lived. They could maybe find their way, but they really didn't know how to do that. And in fact, we got lost several times too, so I can understand why that was the case. And I guess one of the things we'd like to emphasize is think of it being an investment, not a cost. So those things that are more expensive sometimes have early returns, like shade sails over a parking lot provide shade and greater comfort within an hour of putting the shade sail in. You don't have to wait for 10 years for a tree to grow. So it's not that I'm against trees. Obviously, we want them too. But when thinking about, it's not just a matter of what does it cost in terms of making a decision. And so that's us. I think I screwed this up.
Maybe it just goes backwards. You've got it? Good, good, good. I won't. Excellent. Okay, so I'd just like to introduce our final speaker for the day. It's Catherine O'Shea, who spent 25 years in nursing in various hospitals prior to completing a Masters of Environment and Sustainability at Monash University in 2009, where she pivoted to healthcare sustainability. And she is now working in the role of Sustainability Coordinator at Western Health, which we've heard quite a bit about today. She remains passionate, bringing about positive change in the healthcare sector during this critical climate decade. She currently works at Ambulance Victoria as Sustainability Analyst. Welcome, Catherine.
Thank you so much. Yeah, thank you for having me. And I'd like to give you a case study today about developing a climate adaptation plan. I'll just, I guess, checking that you can see only my slides. Is that what you're seeing? Oh, good. Thanks, Carol. Beautiful. Okay, so I'd like to move through that with a little bit of context, and then I guess imitating Peter's very good introduction to my case study by kind of fleshing out all these things that I would have otherwise had to explain. So the scan, he called it the Tier 1 assessment, the detailed risk assessment, and embedding climate adaptation and risk management. So that's really helped me. Thank you, Peter. By way of context, Ambulance Victoria, this piece of work sits within a larger framework, which is our social and environmental responsibility framework, and it's kind of in the environmental, in the environment pillar. So moving further into that context, we do have a rigorous climate mitigation plan, which talks about our emissions reductions over time. You know, we've got a net zero target by 2045, and this other piece of work goes in tandem with the mitigation, the climate adaptation. So that looks to adapt to a changing climate and develop resilience, climate. Hang on, I just need to move something on my screen. Now I can see, to increase our climate resilience and to also increase the climate literacy of our people. So that's kind of where the whole piece of work sits. What's happening now? Sorry. Yes, here we go. So with the initial stage, which is the scan, I think what we realized is we don't know what we don't know. We looked at the very large body of, kind of desktop research and kind of thought, well, really the risk description is that AV doesn't fully understand the impact of climate change to our operations, our service delivery to the community, the welfare of our people, and fails to comply with our legislative obligations. That's kind of where we felt we were at. And in terms of risk to the organisation, our strategic outcomes, high risk to outcome 1 being providing exceptional patient experience, and outcome 4, which is a high performing organisation. It's not a good look not to comply with those kind of things. So it was important. It is important. And so in June 2020, it was brought on to the organisational risk register as one of the top 10 risks. So as part of that initial scan, we did indeed look to all our kind of strategic documents, our emergency management plans. We were kind of looking for representation of this risk throughout, or also looking at how that uncertainty would affect our strategic objectives. And what else did we do? This was a good tool. It looks very complicated, but it's called a bow tie, and it's a tool that starts to distill all those findings into a kind of a picture of sorts. So you can see on the left the causes, and on the right the impacts, and in the middle it's kind of what on middle left what we're proactively doing to reduce those risks, and what we're doing in response to the impacts kind of when they happen. So it's, if you Google bow tie, I think we got this through VMIA, which is Victorian Management Insurance Australia, or something like that, and it was very helpful. So maybe as a little example, the top left, the lack of AV policy approach and plan is filtered through our different emergency response plans, our social and environmental responsibility action plan that we spoke about, some climate related risk disclosure, and it kind of filters through this lack of understanding and comes out the other side in terms of various reporting and different categories of the impact, which are physical, transitional, and the liability would it be a failure to act. So that's a bit technical, but it's a helpful tool, that bow tie. So what we found in our initial scan, our initial tier 1 assessment, as Peter called it, is that climate change is a risk amplifier. We've actually got a lot of, and you will too, I'm sure, of emergency management plans for different parts of the organisation where, different things fail, trains crash, millions of patients come through your doors, all the different scenarios. There's a lot of emergency management planning goes on in healthcare. But what we struggled with, or wrestled with, I think is the right term initially, is how to convey that in terms of the escalation point. How does it, when you've got all these plans in place, how is it different? And I think we were really trying to find a threshold, and that led us so the threshold was that, all these different, the different future that we will be living in 2030, 2050 will impact severely our ability to keep, we call it, adapting to surge of, more patients, more illness, more vulnerable communities. And so it's apparent, but the question, I guess, in this initial phase was, where's that threshold? So some of the findings that we got from the literature that really kind of talked to us were that on average, the number of heat waves was going to increase from between 5 and 8 heat waves each year across the state, with the longest lasting from between 7 to 22 days and the hottest day reaching a maximum of 46 degrees. So, you know, we're kind of all of a sudden thinking Black Saturday, Black Summer events like all the time, you know, like year on year and even more each year. And that started to clarify what we were trying to convey to the organisation in terms of risk. So we then had a really fortuitous kind of contact with DELWP, which is the Department of Environment, Land, Water Planning in Victoria. And they have a lot of tools, and similar to what Peter was talking about with the Queensland government. And so we were able to access some of their people and also their resources, which were helpful throughout the process. They've got a number of different resources. So this particular one helped us to do this, the representative concentration pathways, to choose which ones we wanted to use and which kind of timeline focus that we wanted to place our experience in to try and stress test our organisation. So we ended up choosing a middle ground case and a worst case scenario and set about trying to develop a workshop that would inform our more detailed risk assessment. So let me just move this again. So that's a bit of a trick. So the stress test was a really, you know, the most informative part. I think Claudia and Tony talked about engagement, you know, kind of stakeholder engagement. This is where it all really, the rubber hits the road, and you really need all your people. You need representative across the organisation, and it's the brains trust. It's all those things that have been mentioned earlier, and it all kind of takes place in the form of a workshop, which is really a deep dive into challenging, giving these kind of scenarios to your people and asking them, you know, where would be the weaknesses, where would be the pressure points, where would be, what would be the gaps, how would you cope, and what would happen in such a scenario. And so we were really lucky. We had very engaged people in probably 3 different workshop scenarios. We had kind of one with our sustainability committee, another one with some frontline people and emergency management managers. That's the wrong word, but anyway, a lot of people, a lot of stakeholders, quite representative, and it was very, very interesting, very fun, very validating of all the kind of desktop things that we'd learned, and yeah, really kind of qualified what we were trying to do. So why isn't it going forward? Here we go. Yeah, and another part of this deep dive that we did was something called backcasting, where we kind of looked at previous events, floods and bushfires and virus, the Ross River virus, and kind of other things that had been quite intense for the organisation, and our kind of response, our ability to respond. And particularly flooding is a good example, because where you've had flooding before, you know, that's where it's likely to happen again. And, you know, how did you respond in that year? Did you build back in the same place? Did you, you know, what kind of happened? And it's kind of illuminating to see what happened in the past. And it was nice to also kind of validate that when we were completely flooded out, that we actually didn't build again in that same spot. We moved to higher ground and things like that. So it kind of gave us some kind of historical precedents for like, you know, yeah, we can do this, you know, we have the technology maybe. I think out of that detailed risk assessment, we really had hundreds of data points, and this was really down deep in the weeds, trying to bring it back together in terms of a climate adaptation plan, trying to get out some themes. Yours will probably be different, but these were the themes that we kind of landed on. It's probably not worth going through them because they'll be different for you, but so pulling a lot of data into themes was the task in this climate adaptation stage. And so whilst that felt like it was losing detail and losing richness and losing texture that our staff had so, you know, passionately kind of given to us, this was it felt like you were losing, you know, losing perspective rather than gaining perspective in that distillation. But then in developing the plan, you get to kind of bring that back in full circle, and all those ideas that people had and all those kind of, you know, adaptations that were present in the workshops, what people would do or what people could do that, you know, when you're kind of really thinking and putting yourself in that circumstance, started to it wasn't the only thing that happened in creating an action plan, but, you know, they helped. It felt like you were bringing back the value of those workshops a bit. It folding into one document, it became our Ambulance Victoria Climate Adaptation and Action Plan, actually. And we chose a period of 5 years. We focused on those key themes and developed an ongoing plan of action. And that was all kind of based on those risk scenarios that of the years that we chose, 2030 and 2070. So that was what it became. It's not a draft anymore. It was endorsed through the board about a month ago, so that was good. So yeah, just to wrap up again, this is kind of what it, you know, reminding what I've kind of told you is, so part of our scan, the tools and resources that we used were really a desktop kind of research of DELP was very helpful. Department of Health, also Emergency Management Victoria, they were particularly helpful to our predicament, and that helped us to make a kind of a risk register for climate change, or get it onto the risk register, sorry, the organisational risk register, to give it some priority. The initial assessment, we found the VMIA Bowtie an interesting and good tool to try and distill that into something that you could use as a communication device to your executive. And we really enjoyed working with DELP. Big shout out to DELP. They were just really amazing, and kind of several of their teams actually were very, very helpful, and their resources were very good too. So that helped us.
Hi, Kath. Sorry to interrupt.
Yes.
I might jump in to say that we, if it's all right, we might wrap up now and jump into the Q&A session.
Absolutely. That was my last slide. So that's great. Thanks, Carol.
Thanks, Kath.
And thank you, everyone.
So thanks very much. That was wonderful to see the plans and the assessment in action. Could I ask all the speakers from our session back up to the desk? We'll just have a very quick Q&A round. Okay, so I think we're on. Yep. Dr. Schneider. Peter, is stepwise mitigation response just incurring a staggered delay to global cataclysm?
Sorry, read that very slowly.
I'll try again. Is stepwise mitigation response just incurring a staggered delay to global cataclysm?
Well, any response is good at this point. But a stepwise response, really it depends on the steps. I'm sounding vague, but I'm not meaning to. You set your targets, you work with the low-hanging fruit just to get the juices flowing, and then work from there. I think you can't, in Australia, where we are now, culturally, I don't think you can just dive in and do it all. It really is, you wet your toes and then learn to swim very, very quickly, if I can put it that way. Does that answer the question? Yeah.
It's a good attempt. Thanks, Peter. Question for Tony and Claudia. How can we be kept in the loop regarding when the tools you're developing will be released?
Well, we have a sophisticated media strategy, so we do put everything out that way. Thank you. That was one of the things that we wrote into our project design was a good public communication strategy. So we have been fairly proactive about that. We've had numerous press releases, write-ups in the media. We've published obviously academic papers. We have more to come. We'll be writing for the conversation as well. We did some media around this conference. And so we're out there. I'd say the quickest way to kind of cut to the chase is just Google both of our names and you'll probably get there fairly fast. Alternatively, I'm very happy, and so is Claudia, I'm sure, to respond to anybody directly by email too. But we're doing our best to keep our work in the public domain as much as possible.
And I might just add that the project is due to finish the middle of next year. And so at that point, I'm sure the report will be made widely available. But if anybody's interested in our audit tool in the meantime, we'd be happy to share it and get other people to test it.
There's a lot of interest in the tools to help people do this because it's not something we've done before. And in fact, that's the nature of this question to Catherine. The risk assessment and planning looks like a lot of work. Roughly how many full-time equivalents over how long, and did you use any consultants?
That was the next bit of my presentation. So thank you for the question. And yes, it was, well, we were kind of a team of two in the environment kind of department. So we're lucky to have two full-time resources. And it's, you know, one of many projects that we're doing. And it probably took us 6 months, I think, to go through all those stages. And, you know, that was with some priority. We did use a consultant to help us with the deep dive, the detailed risk assessment. And the biggest help that was really the resources that they gave us, the kind of the template and everything. So I'm agreeing with what you're saying about resources. Really important to have good resources and just a little bit of kind of support along the way. I'd highly recommend it.
Thanks, Kath. And another question for Peter on a similar vein, really. Are almanac style documents available for other states that you know of?
When we started the process, there was a lot of argument about the almanac, and I talked to a few of the executive and pointed out how much information there was, and that trying to let people wade through that and actually come to a common sense outcome, or actually take a consistent approach, was going to fail. So we produced the almanac just for Queensland. We can't do it for other states, our budget won't allow. So the idea was to make the information used as consistent as possible, as accessible as possible, and as easy to understand as possible. So that was the point, and it did work. It's probably the better document of the two, because you take a look at it and there are parts of Queensland that won't be having heat waves. They just have a heat wave for the whole of summer. So it basically tells you this. So it's useful from that perspective. And I think Victoria, I don't know whether they would need something as extensive as an almanac, you know, for Catherine's. I think the way they did it was fantastic, actually, Catherine. Take my hat off to you.
Oh,
but Queensland's huge. Western Australia would definitely need one. New South Wales possibly. So horses for courses, I think.
Time's up. Okay, thanks very much. We might wrap it up there. Could I say thank you so much to all our wonderful speakers? And I'll hand back to Bruce.
Well, to our greening healthcare sector community as we've gathered today, and we've those of you that's joined us online, maybe some of you have come and gone, and as I look around the auditorium now, there's a few people that have got tenacity to hang in there right to the end. I don't know about you, but my head is actually buzzing with all sorts of initiatives, ideas, contacts that I've made. And you must be sitting in a similar space wondering where you might take this. I'm reminded of a number of call-out quotes, and the one that's still sitting is they're taking us from the earth to the moon. They're sitting there centremost at the moment. I remember back earlier in the day, the focus around the challenge from our First Nations people to sit in this space and examine our own gaze, and the deep invitation to internally examine ourselves and the biases that we bring to this sector. And I heard a call to action in that to actually take the time to really listen, because our whole ecosystem is hurting right now. And people shared some of the pain and grief of that. I heard a call to action saying that when we care, we actually have to do something. We can't just hang on to this space. Sustainability really does matter. And not even doing a test matters as well, I heard this afternoon as well, which was quite a realistic invitation that sometimes we make it so complex and get caught in our systems. And when are we going to ask some really hard questions around what we're currently doing? And of course, there was that invitation and there was an acronym around it. Let's make things better. Let's make it better around that. So we're going to throw to our slider posting vote that we did, which was around the posters that were there for the People's Choice Award. And we're going to have a look at the results of that. So can I throw to whoever's got the control of that to bring us up the vote? And there we go. And can I, in making the presentation, want to call out Dr. Stacey Swinkles, Dr. Nathan Murray, and Dr. Danielle Paddy for that. I don't know if any of those people are present here. Yeah, you're going to represent them. So well done. Congratulations. And finally, we're going to throw this to our platform one more time, and I want to invite you to just capture how you're feeling right now as we walk away from this afternoon with our heads full of so much, and there's so much to go and tell and to do, knowing that all this really does matter. I'm wondering what a one word might be that would express how you're feeling right now. And we start to see this take shape before our eyes. People are feeling inspired, hopeful, circular is another phrase, connected, energized, overwhelmed maybe, grateful, inspired, non-anxious, flourishing, a real sense of being connected and motivated. And some people have even got a headache right now. Maybe they've checked out already, I'm not sure about that. But obviously there's still connectivities there contributing to this, this word collage that we've got unfolding in our word cloud before us. Well, look, before I hand over to Fiona Armstrong, who's the Executive Director of our Climate and Health Alliance, and she's going to join us online for the final words. Recently, when I was just recapturing some of the thinking and the call out of what came out of COP26 and our climate summit, I was guided by some of these words, and I haven't authored them, I've just captured them, but a call out saying we can actually do this, folks. We just have to make a choice and do it. And we face a stark choice. We either stop it or it stops us. It's time to actually say enough. And it starts with each of us. And the call to action we've all been challenged about starts with us in our place where we can actually make a difference right now. And that's what we take. As we are reminded around, well, what is that one thing that I could actually do right now as a result of having been here today? What is that one thing? What one thing that I know would put me in a very different place to where we were, and the work that we're a part of would take us in a very different place. One of my call outs around that, which I'm taking away as a challenge, is I think we're yet to really harness the potential of what we collectively bring together. There is such a critical mass of mind here. If we could only harness that and leverage that to its full potential, I believe we can really crack some things that for a while have not only got our attention, but we're finding it difficult to shift by ourselves. But what if we join ranks around this? Even if that's around standards or something, what if we share a different mind around some of the current standards because they actually reinforce the way that we're currently doing things, which is not necessarily picking up the challenge of what we've heard today. There's an offering there. I'm wondering what the one thing is that you might do as we leave this place today. All right, I'm going to throw to Fiona Armstrong, who's our Executive Director of Climate and Health Alliance, and she's going to close us out today.
Thank you so much, Bruce. Can you hear me? Okay, well, thank you all. Thank you so much, Bruce, and thank you for your really thoughtful facilitation today. I think you've really enhanced the quality of the day, which what we're hearing from people is that they've really enjoyed it. So CAHA has had the privilege of working with health sector leaders to deliver sustainable healthcare events and an annual forum since we founded the Global Green and Healthy Hospitals Network in Australia and New Zealand in 2012. And we were really delighted when Uniting Care Queensland agreed to run the forum with us this year to hold it in Brisbane. We've been blown away by the commitment and dedication to organising the forum with us. Uniting Care and particularly Simone Elias have gone above and beyond to help make it what it is. And CAHA couldn't have done it without you, and we appreciate it more than we can say. We're also incredibly grateful to Uniting Care's early and ongoing leadership in delivering environmentally sustainable healthcare, and Uniting Care's willingness to collaborate and engage with health institutions outside their organisation to help drive change. I want to acknowledge my colleague Carol Beanie, CAHA's Sustainable Healthcare Program Manager, whose leadership is an ongoing source of inspiration to me, and for her incredibly hard work with Simone over many months to make this forum happen. It was deeply disappointing for Carol not to be able to travel from Victoria to be in Brisbane today. So thanks to CAHA colleagues Millie, who is in Queensland, and thanks to Ben and Remy, who are supporting in the background. A brief message about Global Green and Healthy Hospitals. Uniting Care has been contributing to our GGHH network for many years and is a global award winner for their leadership in this space. So if your hospital, health service or health organisation isn't yet a member, we encourage you to join. Membership is free and provides access to a network of sustainable healthcare colleagues, resources and opportunities to demonstrate leadership. CAHA, and specifically Carol, coordinates GGHH in the Pacific region and can provide more information about how to join in the post-forum materials. Thanks so much, of course, to all our incredibly impressive speakers and facilitators. Too many to mention, but thank you all. What a very rich and inspiring day it has been. Thank you to Metro North Health, another GGHH member, for providing this wonderful venue in Brisbane at no charge, and for the support of the Metro North staff in preparing and delivering the forum. Thank you to our major sponsor, Cleanaway, for helping to make the forum possible. Thanks also to our exhibiting sponsors, Gem Energy, EcoAid, HESTA, and Edge Environment. Thank you to our promotional partners for their contribution to improving the environmental impact of healthcare and helping to spread the word about the forum. Queensland Nurses and Midwives Union, Australian Hospitals and Healthcare Association, Doctors for the Environment Australia, and the Australian College of Health Service Management. And thanks also to the steering committee members and event volunteers. Thank you so much to everyone who joined the forum today, whether you joined in person or online. Thank you for your interest. Thank you for your efforts to help our health sector move towards becoming net zero emissions, climate resilient, equitable, and environmentally sustainable, and ensure good health for all. Thank you.